This is a single-payer statewide health system for all Illinoisans, the only solution for Illinois. My name is Nicholas Skala. Eliminating private health insurance companies and streamlining health financing through a single public payer could recover enough currently wasted money to cover all the uninsured. The Harvard researchers estimated that the U.S. could save $350 billion with a single-payer system. In Illinois, we could save about $17 billion of our $87 billion in health spending. Combined with what we're currently spending out of pocket and in taxes, that's enough to provide comprehensive coverage to every Illinoisan without spending any more than we are now. The single-payer plan is very simple. Step 1 is eliminating private insurers, freeing up $17 billion in administrative waste. Step 2 is to roll current state and federal funding, Medicare, Medicaid, etc., into a single public or quasi-public fund. Step 3 is to eliminate premiums, copays, deductibles, and the other out-of-pocket costs that families and businesses pay. These funds, which currently go to push paper around, will be redirected through a progressive income contribution so that now the money pays for care, not for administrative costs. Since private insurance inefficiencies are cut out, this will be a tax cut for most individuals and businesses. Nearly all will be paying less. The single-payer entity would negotiate a formulary with physicians, like Medicare does now, globally budget hospitals, increase primary and preventive care by removing barriers to access, and bulk purchase drugs and medical supplies. All this means that costs will be controlled long-term so that the single-payer benefits are sustainable. The benefits for single-payer are comprehensive coverage for all medically necessary services. What's covered is doctor, hospital, long-term care, mental health, vision, dental, drug, etc. There's free choice of doctor and hospital. Health workers are unleashed from corporate dictates over patient care. HMOs will not be telling doctors what they can and can't do as far as patient treatment anymore. And hospitals are guaranteed a secure and regular budget. And we're in an election year, and the candidates, the pundits, and the interest group have been putting forward a plethora of plans in the hopes of influencing the candidates' agendas. The media often presents the health reform debate as though there were a bevy of different approaches to fixing our broken health system. But the convoluted proposals and policy jargon can be easily simplified. There are only two options for reform. The first is to preserve private insurance companies as the primary financiers of our health system, preserving all the waste that comes with them. The second is to replace them with a national health insurance system for everybody. Our Governor Blagojevich recently introduced a proposal called Illinois Covered that was heralded for its innovativeness, but really looked a lot like proposals all over the country and a lot like the ones being proposed on the national level. It included a modest expansion of public coverage, tax credits to buy coverage from private insurers, and a state risk pool, which would put the uninsured together ostensibly to bargain down healthcare costs. But a little noticed and little talked about provision in the governor's plan was an individual mandate, or what we like to call the Marie Antoinette approach to providing universal health coverage. It essentially criminalizes being uninsured, forcing people to buy defective insurance company products or pay a heavy fine. Because the Illinois individual mandate plan is so similar to the Massachusetts individual mandate plan, the Massachusetts experience is instructive. Upon passage, Massachusetts promised comprehensive coverage for affordable prices, but quickly learned that this was impossible. This slide quickly gives some context to an individual mandate plan. Massachusetts planned to punish those who failed to buy insurance company products by charging them a fine, 50% of the cost of the policy's premium. Even if the state could manage a $250 per month premium, the penalty for not buying a defective insurance industry product would be more than the normal fines for drunk driving, domestic assault, or making a terrorist threat. Illinois proposes to charge violators not 50%, but up to 115% of the cost of a policy. It's easy to see that there's something wrong with a plan that says an uninsured resident is worse than a spousal abuser or a terrorist. This is the road that we're on now in Illinois. This slide compares Mary Flower's House Bill 311, the Healthcare for All Illinois Act, with the governor's Illinois Covered Plan. Whereas in the governor's plan, as many as 2/3 of the uninsured stayed that way. Under the single-payer plan, all Illinois residents were covered. The benefits under single-payer were full coverage for all medically necessary needs, whereas the governor offered only skimpy policies which restricted access and protection. The Flowers bill would expand Medicare to all Illinoisans. The Blagojevich plan would punish people who didn't buy insurance industry products. Flowers funds her plan through a redirection of $17 billion in administrative waste, meaning no net cost increase for anyone. The Blagojevich plan was to raise $2.1 billion in new taxes to waste on private insurers who take a one-third cut for administrative costs. And finally, the single-payer plan was effective in cost control, ensuring sustainable benefits for everyone for the future. And in the Blagojevich plan, any gains in coverage would quickly be erased by rising costs. The problems with the Blagojevich plan are common to all subsidy and individual mandate schemes. That's why they will never work as solutions to the healthcare crisis. They offer substandard coverage. They're unaffordable. They offer micro coverage for macro costs, preserving wasteful private insurers and adding another layer of state administrative waste. And they offer no realistic cost control, so any gains in public coverage will be unsustainable due to rising costs. Perhaps the criticism most often leveled against single-payer is that it's a good idea, but it's just not politically feasible. But whenever the public's polled, regularly 2/3 say that they want it. 59% of physicians say that they want a single-payer system. And perhaps most significantly, the business community and traditionally conservative sectors are now realizing the need for it as they become crushed by healthcare costs and competition from nations with national health insurance systems. This is Glenn Barton, the former CEO of Caterpillar. He's the past chairman of the Health and Retirement Task Force of the Business Roundtable, representing 150 of the nation's largest employers that have total assets of more than $4 trillion. He gave written testimony to Illinois' Adequate Healthcare Task Force, saying the quickest and simplest solution is to go to a single-payer system. The conservative business press has also started to realize the need for single-payer in the face of hefty competition in manufacturing and other sectors from industrialized countries with social insurance systems. The Wall Street Journal says if done right, healthcare in America could be dramatically better with true single-payer coverage. Fortune magazine says single-payer is an idea that's so easy to slam politically, yet so sensible for business that only Republicans can sell it. It may take a Republican president to bless the socialization of health spending that we need. And CNBC MSN Money says, think as a small business how you could benefit from a single-payer system. You wouldn't lose potential employers to larger firms that offer more attractive health benefits. Health insurance costs would cease to be a line item in your budget. A serious illness befalling you or an employee wouldn't be a company-wide financial crisis. You might even save money. Another one of the arguments most commonly made by advocates of incremental reforms, such as the governor's, is that while these measures are insufficient to solve the health crisis, they're worthwhile, achievable steps to single-payer coverage. Yet despite all their claims of pragmatism, incremental reformers have been unable to shepherd through meaningful reform in nearly 4 decades of trying. Upon passage, incremental reforms in each of these states was hailed by politicians and the media as a step towards universal coverage. Today, not one has achieved it. The definition of insanity is to repeat an action expecting a different result. This is exactly what we have done. And while these distractions have diverted attention away from the real solution, the problem has only gotten worse. Should we lose sight of the true solution, Illinois will suffer the same fate. What our state needs is not more patchwork reforms. We need leaders willing to stand up for the only solution that will work: a single-payer statewide health insurance system for all Illinoisans. Many would-be supporters of single-payer health insurance find themselves eager to compromise when political opportunity presents itself. True reform, they say, is too infeasible, and by advocating the perfect, one becomes the enemy of the good. The reality of social progress contradicts this interpretation. A celebrated new history of one of our state's great heroes provides a fine example. Contrary to the popular perception of Abraham Lincoln as a committed abolitionist who restrained himself in skillful political maneuver, Professor James Oak shows that it was only the constant popular pressure deployed by abolitionists that eventually created the platform upon which Lincoln could embrace emancipation. Similarly, single-payer supporters must be ever vigilant in advocating the true solution. We have seen in the experience of other states what happens when we lose sight and compromise. The history of great social achievement is rife with instances in which forces of institutionalized power told social movements that what they wanted was politically infeasible, and they would have to prepare themselves to compromise and settle for half measures. The abolition of human slavery, the enfranchisement of women, the Civil Rights Act, an end to child labor, the 40-hour work week, minimum wage laws, Social Security. In each of these instances, activists held fast to their principles and soon discovered that what was impossible or politically infeasible was suddenly possible.